Tēnā koutou katoa. Good morning, everybody. Thanks, Graham. Thank you very much for that introduction. It's going to be a double header this morning, actually. I'm going to make a few comments, and then our health spokesperson, David Clark, is going to talk more specifically about what it is that we are committing to for health and specifically for cancer treatment for New Zealand. So, in addition to acknowledging you, Graham, can I also acknowledge the President of the Prostate Cancer Foundation, Mark von Dadelsen, the Vice President of the Urological Society of Australia and New Zealand, Dr. Stephen Mark, Andrea Nixon, the Chair of the New Zealand Urological Nurses Society, and welcome you all and thank you for the welcome you've given me. So I guess my role here is what might be described as the product endorsement phase of the morning. I am here as a result of the good work both that the Prostate Cancer Foundation does, but actually that the health system was able to provide me. So 8 years ago, I was diagnosed with prostate cancer and went through, all those processes that you get to before you kind of get your final diagnosis. And the way I was diagnosed, even sort of asking for a test, was pretty banal, actually. I had a regular medical checkup. As I left to go to work that morning, my wife, Lee, who was a registered nurse, she had said, make sure you get your PSA done. Not something we'd particularly spoken about, but just she had a hunch that I should have it done. She did say to me afterwards that the reason she said that is that she had thought that she saw symptoms, mainly, going to the bathroom first thing in the morning. She thought that was it was different for me at a particular time. So she had hollered out, make sure you get your PSA done. And so when I turned up to the doctor for my checkup in typical male fashion, and he was ticking all the things that he wanted checked off, I said, my wife says I should have my PSA done. I had a fantastic doctor, and he said, look, you're too young, you don't really need it. But you know what, you're having blood tests anyway, so why don't we just tick that box? So we did. Now, I'm not somebody who goes to the doctor very often. I did have that checkup. And so when I get a message on my phone saying, please ring your doctor as soon as possible, I'd never had that message ever before. So that got me wondering, possibly worrying, actually. So I returned the message and I'm told PSA result has come back and it is a little elevated, or at least the doctor said higher than he would have expected. So we agreed that we'd leave it for a couple of 3 months and have the test again. And so I had the test again and it was even more elevated, to the point when I got the message again, I rang the doctor quickly, even more quickly this time. And the message was that the speed with which it had risen was of concern. So go in for the consultation. And that's kind of I'm one of these people who I don't particularly worry unless I've got a very good reason to do so. I'm not a panicker. And even when you're confronted with, challenges, I'm not somebody who feels the need to go running around like a chicken with its head cut off and give the appearance of doing things that actually isn't doing anything at all. So I take these sort of things in my stride. But when the doctor says you need to come in and talk about where we go to from here, you cannot do anything other than start to feel concerned. And of course, for me, I think I can say of myself, I am the last person I think of. It was my family, my wife. My son was 8 years old at the time, and they're the ones who I immediately think of, because you do think, how could this turn out? And what if it isn't the best? And what if, in fact, it is the worst? You think about those closest to you. So the next stage was to have the biopsy. I'm not going to go into the detail of that. I saw the diagrams in the booklet. I have a very good friend of mine who lives in Australia. When I say a good friend, we are in contact with each other probably a couple of times a year. We catch up with each other when we're in each other's cities, and we maybe give each other a phone call. He wouldn't have sent me an email for about 5 or 6 years. He heard, and I told him obviously that I got the diagnosis and I was having a biopsy. He emailed me concerned about the biopsy and the procedure that it entailed, because the diagrams certainly made it look painful, and I was very glad to be able to have it under a general anaesthetic. So that had its own kind of aspects to it as well. So we have the biopsy, we get the confirmation about the extent and nature of it, and then it's a discussion about the treatment options, and then there is the treatment. And through all of those things, through all of those stages and steps, as well as trying to focus on the job I had as a union secretary at the time, and I happened to be president of the Labour Party at the time, you cannot get away from thinking about the range of possibilities. And you value the people closest to you more than you ever have before. Your family, my wife and my son, the friends who were around me. And at some point I had to tell the staff of the organisation that I was running, say, this is what's happening. All of that stuff can be a challenge. I'm not someone who easily lets people into the personal and intimate sides of my life. But you've got to be upfront with people. There is that uncertainty, and you've got to deal with that and get through it. I had the option to choose brachytherapy as my treatment for my prostate cancer. I was very glad that I did so. It wasn't publicly funded at the time, but I had some savings and I made that choice. It meant that I was back on my feet within days. In fact, the story that I tell is that literally a week after I had that treatment, was in hospital having the radioactive seeds implanted into my prostate, I was giving my first address to the Labour Party's annual conference as party president. I didn't admit then, but I have since, that actually I stood there in my full radioactive glory in full breach of the party's anti-nuclear policy and got through unscathed. That was the benefit of that treatment option. What it does, what going through that experience, and when I look back on it, I can say, look, that was a reasonably mild brush with fate. But it does make you think very carefully about your priorities in life. And for me, it was about family. For me, it was about taking opportunities, taking risks and opportunities for a more fulfilling life. And that's what drives me. But it does something else too. I said before, I'm not somebody who dwells a lot on me and what's good for me. My professional life was devoted to advocating for and helping others, and in my political life, you can't help but do that. And one of the things that it has absolutely driven me to believe in is the need for a good quality public health system, one that is there for everyone. And in a small little country like ours, not a poor country, we are actually a wealthy country, we ought to be able to provide a good standard of healthcare, but most importantly for our small population, a consistently good standard of healthcare regardless of where you live. And I'm determined to make sure, if I get the opportunity, that we do have that health system, that we commit ourselves to investing in a health system and setting up the institutions around it, so that every New Zealander, regardless of where they are and the circumstances into which they are born, can be sure they are going to get the best quality health care that we ought to expect in a country like ours. As a political party, we are committed to strong social foundations. It's why we make a fuss about housing, which is a big determinant of health. It's why we make a fuss about education, which is a big determinant of future life opportunities. And it's why we make a fuss about our health service and our health system. Today, we are making an announcement that is about improving the chance for more New Zealanders to get better cancer treatment. And that is the establishment of a national cancer agency that is there to provide a much better level of coordination and focus and ensure that a consistently available standard of treatment is available to every New Zealander regardless of where they live. Because I don't think New Zealanders deserve anything less in the 21st century and the kind of health system that we ought to be having. I'm going to ask my colleague David Clark, our health spokesperson, to elucidate and provide further details on that. Can I just conclude by thanking all of you for the work that you do if you're a health professional in the prostate cancer area or an advocate, one of the organisations that advocates for prostate cancer sufferers. Thank you for the work you do for keeping prostate cancer on the health agenda, if you like, keeping it a priority. Because your work and the work of all of us and the work that we all get to do for a world-class health system will save men's lives. And that's a good thing. And the more we can do of that, the better. Thank you this morning.
Kia ora koutou, ngā mihi kia koutou. My name is David Clark and I am Labour's health spokesperson, filling the very big shoes of Annette King, I hope, in an incoming Labour government. I want to start where Andrew left off actually with two thank yous. Firstly, the thank you that he just delivered to you as advocates and professionals in the sector. Thank you for the work you do in what is increasingly a difficult environment. We have at the moment, I believe, an underperforming Ministry of Health, an underfunded sector and a very disengaged minister. And you are, exactly as Andrew said, maintaining that leadership and advocacy that keeps cancer on the agenda. So thank you for that. I also want to acknowledge and thank Andrew for his leadership in this area. He has facilitated the policy we have today and has provided leadership in making sure it is one of the headline messages that we take to this election, because it is important for so many New Zealanders. 1/3 of New Zealanders will die of cancer, and at the moment we don't have the coordinated care that we need. You know that already, but I want to acknowledge Andrew's leadership in bringing this issue to the fore. I start my job with the proposition that I think most New Zealanders would share, that every New Zealander should be able to have affordable access to quality healthcare. At the moment, though, there are real questions around affordability, around access, and around variability in quality of care. Last year, over 500,000 New Zealanders couldn't afford to go to their local GP for reasons of cost, and that's the government's own healthcare survey that tells us that. Last year, 60,000 people were turned away from the hospital before they got a first specialist assessment that was recommended by their GP. And of course, their GP didn't write that letter as a kind of practical joke. The GP genuinely thought they needed to see a specialist, but the hospital wrote them a letter saying, "We don't have the resource right now. Please go back to your GP if you can afford it. Come back to us when your condition worsens." So there are questions around access. And we know, particularly in the cancer space, there are questions around quality and variability by DHB. For example, we know that the standards that are supposed to be put in place, the tumour standards program, has been in draft for 4 years. We know that radiation treatment is much more available in Wellington than it is in Auckland. And there is no level of accountability at the moment for DHBs around the provision of equitable care, and no plans from the Ministry of Health to address this in the immediate future. So today I'm very proud to stand alongside our leader and the man I hope will be New Zealand's next Prime Minister, Andrew Little, himself a cancer survivor and someone dedicated to making the proposition that all New Zealanders share affordable access to quality healthcare a reality. And I announce alongside Andrew that we're going to set up a National Cancer Agency. In broad brush, the Cancer Agency will make sure that all New Zealanders get the same level of cancer care no matter where in the country they live. It'll ensure New Zealanders get world-class cancer care, and that is going to be funded through a portion of the $8 billion extra we plan to spend in terms of an investment in health, because we are saying no to the tax cuts that National is pushing in election year. We think that healthcare and the provision of affordable access to quality healthcare is a bigger priority. And thirdly, it will streamline cancer care in New Zealand by through the establishment of the agency and its leadership function. It'll bring together 10 tumour standards groups, 4 regional cancer networks and cancer screening networks across the country under one organisation that will be appropriately resourced to deliver a consistent high standard of cancer care. The agency will oversee prevention, detection, treatment, and we know that has been done effectively in the UK and Canada with similar models, and it will improve the outcomes for survivors. More specifically, in terms of goals, it will end what is now the postcode lottery by implementing standard treatment pathways for cancer care in all DHBs and ensure that DHBs have the resources they need to deliver the best level of care. They will develop in their first year a national cancer plan, and they'll develop targets to reduce death rates. They will oversee a single national cancer clinical trials network so that it can be accessed from across the country, and that will mean that there'll be one contract for those trials, and you won't have to be in a lottery by DHB to access that care. They'll prioritise investment in the most effective technology, such as the latest radiation treatments. And importantly, they will research and collect data on treatment outcomes to inform best practice into the future. To fund this National Cancer Agency, they will be allocated $10 million in the first year for resources, establishment costs and so on, and then $10 million for actual operations. Their budget will vary from year to year after that as they make bids to improve the standard of cancer care across the country. And we'll work with cancer care experts and frontline professionals to develop the work plan to achieve these goals. And the National Cancer Agency will ensure that all New Zealanders diagnosed with cancer know that they will have access to the same high quality level of cancer care wherever they live. This initiative will save lives. Thank you very much.